Have you been told that you need surgery for your particular pelvic floor issues and you're trying to decide how best to decide on the right surgeon for yourself? This decision can be overwhelming, but it doesn't have to be, because in today's video, we're going to be talking about how to decide on the best surgeon for you. Hi everyone, I'm Dr. Nabila Noor, board certified and fellowship trained urogynecologist and a pelvic reconstructive surgeon. And in this channel, we talk about everything pelvic health, how to take care of it, and when to seek help. If you like what you see, don't forget to subscribe and don't forget to share it with a friend. Choosing the right surgeon is a critical decision for your health and your recovery, but it can be overwhelming, especially if you don't know what specific characteristics you're looking for. So in today's video, I'm going to give you my 5 tips to choose the right surgeon for you. Number 1, board certifications and credentials. Make sure that your surgeon has the board certification and credentialing, or is at least board eligible for the particular specialty you're looking for. What that means is that it gives you a benchmark that the surgeon has completed the appropriate education, the proper training, and have completed the competency standards needed to provide the right care for patients in that particular specialty. If you're looking for a subspecialist, making sure that they have the appropriate fellowship training can be helpful as well. For example, somebody like myself. So my background is initially in obstetrics and gynecology. So after I completed my medical school, I did my residency training in obstetrics and gynecology, where I took care of patients who were pregnant as well as women who were not pregnant. However, after completing residency, I decided I wanted to specialize or subspecialize in taking care of women suffering with pelvic floor issues. So that's when I decided to go through 3 years of additional training, which is known as fellowship. That's where I did more advanced training in robotic surgery, in laparoscopic surgery, and gained the appropriate knowledge necessary to provide the most up-to-date evidence-based care for patients suffering with pelvic floor issues. Now, not every surgeon will have fellowship training, but again, if you're looking for a particular specialty that requires it, having that fellowship training can be beneficial. Number 2, experience and specialization. It's a well-researched topic that high-volume surgeons have better outcomes. And so if you're thinking about a surgery, you want to make sure that in addition to the appropriate board certifications and credentialing, your surgeon also has adequate experience in performing the kind of surgeries you're looking for. Number 3, hospital affiliations and facilities. Always check out the facilities or the hospital in which your surgeon provides their procedures, because surgery is a team sport. Your surgeon cannot perform these surgeries alone. They need a whole team, whether it be the nursing staff, the ancillary staff. Sometimes being at a facility where they have access to a lot of resources can be really helpful. So being at a big hospital where they have a lot of resources available as needed can be really beneficial. Number 4, patient reviews and testimonials. Looking at patient reviews and testimonials can give you a sense of, what the surgeon is all about, what is their bedside manner like, how do they communicate, what's been the experience of other patients who've gone through similar issues that you're suffering from. So that will give you an insight about what you could expect from this particular surgeon. Also, in today's day and age with social media, a lot of surgeons are making themselves available on social media. For example, myself, one of the reasons I started social media was to be able to reach out to a larger patient population so that my patients could get a taste of, what to expect when they come see me and experience me and hopefully like what they see. So that can be really helpful. So when you're seeing consistent positive feedback, that can be a marker of reliability and a good surgeon. And finally, number 5, comfort, communication, and trust in your surgeon. So this is probably the most important factor, because you as a patient should feel comfortable talking to your surgeon about the procedures. They should be able to explain the procedure to you, talk to you about various risks, benefits, the success rates, and most importantly, you should feel comfortable asking them questions and also be able to trust them and their judgment. A good surgeon will always listen to your concerns, answer your questions, and make you a part of that decision-making process. A lot of the times I'll have patients come to me for a second opinion or a third opinion, maybe because they didn't have a very positive experience with a particular surgeon. Sometimes, it can happen. We're all different individuals. Not every patient will connect with every surgeon, and that's okay. If I have a patient ever who I feel that, we're not kind of communicating or we're not on the same page, I always encourage them that they get a second opinion or even a third opinion if needed. You definitely don't want to go doctor shopping, because again, it's a relationship of trust. But if you don't feel that you cannot communicate with your surgeon or you're not being able to trust their judgment, Getting a different opinion is always helpful. If nothing, at least it will give you the peace of mind that you're making the right decision for yourself. The decision of having to go through surgery can be very overwhelming, but finding the right surgeon doesn't have to be. So do your research, put in the time at the beginning. Hopefully the tips that I shared will make it a little bit easier for you to find the right surgeon. If you can, talk to others who may have had treatment with that particular surgeon to get a more inside information. Never be afraid to ask questions to your surgeons, because if it's the right surgeon for you and if it's a good surgeon, they'll be more than happy to answer all your questions and make you feel at ease with the decision to pursue surgery. Hope to see you soon. Bye.